Next, I want to discuss about Sphincter Manometer, which is for measuring blood pressure. Okay, so that's this part of, and this pump and this gauge. And there's another one, which is a stethoscope, which is directly measuring the sound by using this diaphragm sensor and your ear. So this combination of Sphincter Manometer and a stethoscope is a traditional way of measuring our blood pressure. So usually using your arms and measuring the right artery. So why measure blood pressure? This is also very important for knowing health status of your cardiovascular system. So this diagram shows that the artery in our arm, and you see these are arteries, so there's like pulsation directly from our heart, and that pressure cuff giving this pressure, and you first elevate the pressure high enough that you squeeze the artery until it doesn't flow anymore, and then you release slowly. Then what happens is, as you remember, that this narrowing makes the flow faster, and that gives a high Reynolds number or make the flow turbulent. Turbulent is irregular and making an eddy, and that gives you a specific sound of shh, 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 depending on your pulse together. So with that sound, we can measure the sound with the Sphincter Manometer. So when we measure our blood pressure, and we will find out chronic high blood pressure, which we call tension. And that's defined by systolic and diastolic pressure as higher than 140 and 90 millimilli Hg. And what this indicates is a risk of cardiovascular disease, such as atherosclerosis in your vessels, and heart attack or stroke has higher risk. On the other hand, you could have very low blood pressure, which we call not hyper, but hypotension. And when does hypotension can occur? And if there's a big trauma that you lose your blood volume, and rapid blood loss can give you hypotension, and also hypothermia, which could be dangerous because if you lack of blood, you lack of oxygen delivery to organs, and you lead to shock. So this is very important to catch if one patient have hypotension. So what are the normal range for blood pressure, which is about systolic pressure as lower than 120 and diastolic pressure as lower than 80 millimilli Hg. And nowadays, these traditional measurement can be replaced by more advancement of technology, which is using, remember, mechanical sensor, measuring the pressure by the stretch of the surface of this cuff. So that is this electronic ways, and there's a mechanical strain gauge inside, which measures the pressure directly. And even you analyze this data well enough, you can even measure the pulse rate as well. So given the high blood pressure, I just want to mention a little bit of the definition of high blood pressure. And you can see normal, below 120 and below 80 for diastolic. There's a pre-hypertension in this range, and high blood pressure or hypertension is defined as higher than 140 and higher than 90. That's stage 1 hypertension. If you are stage 2, that's dangerous. That's higher than 160 and 100 for systolic and diastolic pressure. And why this become a problem? Because you see, there are many of risk involved with high blood pressure, such as cerebrovascular accident, stroke can happen more, and hypertensive encephalopathy. And apathy means that this kind of pathology involved. So you can have confusion, headache, and conversion. And retina of the eye is also sensitive for the pressure. And if there's hypertension, then hypertensive retinopathy, which affects our retina. And blood, this can leave elevated sugar levels, and heart, MI or myocardial infarction, which is simply heart attack can happen. And hypertension makes your heart abnormal, heart muscle or cardiomyopathy, or it can lead to heart failure. And also your kidneys as well. Kidneys filter a lot of your blood a day, like almost like over 1,800 liters, and that kidney can suffer from hypertensive nephropathy that leads to chronic renal failure. So one noticeable thing is you see over age, there are data showing blood pressure of this keep increasing. So even if you have a lower blood pressure, you're okay, but you see over age, your blood pressure is always tend to go higher and higher. Okay, so that's why we have to pay attention to this. And so because of that, let's talk about measurement of blood pressure. And traditionally, this is called Oscultatory Method. And auscultation is meaning as a listening to sound within the body. So this is to remember with a pressure cuff, and you release the pressure that is shown as a gray over time. So you release, and this red is your arterial blood pressure. So when cuff pressure is higher, then it squeezes. So it squeezes completely the artery, so you don't listen any sound. But once it's in between, then the flow starts to move, and that pulse generating turbulence will causes a sound, which we call auscultation, listening to sound. And so you see, listen the sound, and that's called carotid cuff sound. And until the cuff pressure is lower than the actual arterial pressure, then you don't hear sound because you're not squeezing the artery anymore. The artery will smoothly flow. Until you have this squeezement, then there's a sound here. So by detecting this carotid cuff sound with higher beginning and then later, you can read systolic pressure and diastolic pressure. So detection of carotid cuff sound with pressure cuff and a stethoscope. Okay, so when this method is not feasible, so that's actually when a patient has a underlying lung problem, and you need to check CO2 and oxygen of blood frequently, then this method may not be useful. On the other hand, there are like a more precise measurement called catheter-based blood pressure measurement, that you want to measure blood pressure within a blood vessel. So this is invasive, only used when within specific vessel measurement is necessary. For example, if someone's are suspected as having pulmonary hypertension, which is hypertension only inside a vessel in the lung, then pulmonary artery need to be measured for blood pressure. So through the heart, the catheter-based blood pressure can get into right ventricle, right atrium. It goes to pulmonary artery, so that it can measure the pressure of pulmonary artery. So, so that extravascular pressure measurement, I want to give you an example, which happened to be, I was involved in making this fiber optic-based Febrile pressure sensor based on lensed fiber and polymeric diaphragm. So what that means is we created a optical fiber where the light goes in, and there's a lensed fiber was made, and that fiber is reflected from a polymeric diaphragm, which is polymer, so that it responds to pressure. That tiny displacement can be measured by optical interference, and which can be detected by this optical spectrum analyzer with a broadband light source. So, and to create this, and we need to have a create this lensed fiber, and with having this electric arc discharge to make it like lens, so that we create this and we actually publish this one and generate patents. So that's kind of an example of very fine extravascular pressure measurement system. You could potentially use it for inside the body. And another is the intravascular pressure transducers, which is a very, very tiny, you see this out of this coin, and tiny, tiny sensors can be directly put it inside the vessel and measure pressure. So this is the diagram showing pressure sensitive beam and compensation of control. And the actual electron microscope shows these fabricated devices.